So I guess we had a little interruption of our video stream,
Yeah.
so I think that
Sorry
we're
about
back
that.
on. So you got a little breather there.
Yeah. Anyway, so
Thankfully, I wasn't talking. They usually am talking when I'm tuned out.
So anyways, we were talking about WebMD and how you just need to be careful. I think you just need to probably just maybe use it for a little bit of help and not to diagnose yourself necessarily.
Well, I think the problem with most medical conditions that people don't understand is there is a huge overlap of symptoms for many things. So, if you type in something like fatigue or, low energy, well, you're going to get about 5,000 things, from something that you're going to die from to something that could just be very minor. So even if you add in a couple of extra ones, it doesn't always narrow it down, and that's kind of why you have to kind of look at everything as a total and really put everything together about patient symptoms, because it's not just so easy to do it that way.
Yeah. So moving on, I want to talk about weight loss, unless you have something that you want to talk about first. Good? Okay. So coming into the holiday season, lots of issues usually come about where you're going to have gaining some weight. So I like to kind of go in, try and be a little healthier in September, October, prepping for the weight that I'm about to gain on those holidays. So we have a lot of people thinking the same way, coming and starting weight loss programs, and I just want to talk about some tips, and then I also want to talk about a really big topic is phentermine and phenmetrazine and HCG and all of those types of things. But one thing that we have found in weight loss is a lot of people will come in, start a weight loss program, whether it's here or anywhere, and then they'll go read an article, and then they'll be like, oh, well, I'm doing this, but they said this, and then they go talk to their friend, and their friend says, oh, but you should do this, and then they've got like all these different opinions, and it totally screws you up and frustrates you. So I think it's important that you decide what way you want to go and stick with it, because there are many different ways to lose weight and get healthy.
Correct. So that being said, there's a lot of different programs, and there's really not one that is magical. There's no magic shakes that someone can drink that's going to make them lose weight. There's no magic shots. There's no magic pills. And so, you have to kind of look at things all together. And not only that, you have to, and it's not one thing. If someone says, hey, you drink these shakes every day, you're going to lose weight. Or if you take these vitamin shots every day, you're going to lose weight. Or if you take phentermine every day, and you take them separately, guess what? None of them work. None of them work. And so they may work for a couple of days, but then they fail. And one of the things that one of the reasons why they fail is basically, one is accountability. Secondly, they're not really training you how to eat and how to move on past this diet and weight loss. So you can take anybody, put them on phentermine for 2 or 3 weeks, blast their appetite so that they can't eat, and they're going to lose some weight. But guess what? As soon as they come off, they have not learned one thing. They're going to gain all that weight back and more. And that's the problem. And there's a lot of people that just call and say, hey, I've seen a prescription for phentermine. I don't need to do the weight loss program, or I just need some phentermine, or my doctor put me on phentermine. Phentermine is a controlled substance. It is relatively safe under controlled situations. So in other words, it's not just meant to be used willy-nilly anytime you feel like, oh, I feel like I need a little energy today, or I think I'm a little fat, I'm going to take a phentermine today, and that's it, and then skip a meal, then take it the next day, not take it. And that's how a lot of people do it. They do it very hit and miss. Unfortunately, there are many providers who willingly give this to patients because they feel that it's very safe. And truly, it is pretty safe. I mean, of all the controlled substances, it is safe. But that being said, there are people who do have reactions to it. And I think you're not doing your patient any service at all by just saying, here's a prescription for phentermine because, you want to lose weight. I don't want to listen to one thing that you have to say. I don't want to spend one more minute with you trying to help you lose weight. But if I give you a prescription for phentermine, you will shut up and you will leave and you'll be happy because you got what you want. The problem is they won't have gotten what they want because they'll take the phentermine, they'll lose some weight, and then they'll gain it all back and more. So then they'll say, oh, I did the phentermine diet and it didn't work. Duh, it's not a diet. It is a crutch for a diet. And it's really, what we are doing is a lifestyle change. There's no other way around it. People want to find the quick fix, whether it be a bar, a shake, or something that they have to take, but they're not there. And you have to do everything. Yes, there are protein shakes that are good to give you, for meal replacements, and they have plenty of protein in them. But that's not it. You have to still master eating. You're not going to live on shakes the rest of your life. You're going to have to be put into social situations where you're still going to have to make food choices and know what those food choices are and what's the good things and what are the bad things. Because if you don't really get trained, you've not really learned much about it, and you're not going to really ever be able to do it on your own and maintain. All you're going to do is, during that period of weight loss, lose it and then gain it right back. So that's one thing with weight loss programs. The other thing that weight loss, so you have to be comprehensive. You have to educate and train people on how to really eat properly, because it's very deceiving. Our lives have changed dramatically as far as the food sources that we are available to. It used to be people ate out once a week. They had McDonald's, Burger King, any of these fast foods once a week. It was a treat when we were kind of running behind. Now it's a mainstay. And so really, any of those foods and eating out once a week are fine. They are not going to be disruptive. It's the daily use. There's all of the processing of the food, so there's all the chemicals that are in there. That's one thing. But secondly, they're super high in calories. So when you're doing that as meal after meal after meal because of lack of time and all of this other kind of stuff, it's no wonder why you're gaining weight and feeling miserable. So we have to just redirect ourselves and retrain ourselves to the priority of saying, listen, we are going to have to do meal preparations for ourselves, and we're going to have to take that extra time to do it. And there really is plenty of opportunity to do it. There really are plenty of food sources that are there to be able to do it. Even within the stores, they have made things much easier. They put things in individual packets. They
really have. They have some very healthy choices. Very easy to grab. It may not be going through a drive-through. You might have to actually get out of your car and go in the store, but you can get healthy choices. And that's the problem, is people don't have time, and so they're just making quick, unhealthy choices. But it can be done. It really can. But that's what he's saying about a weight loss program. It's not just taking a pill. It's learning how to live your life as busy as you are, making the right choices with food, and how to lose weight. And phentermine is just a crutch. It just helps you maybe make a couple better choices, knowing what those choices might be because you've been taught, because maybe you're not as hungry. But how long is phentermine really effective to help with your appetite?
Maybe 60 to 90 days. And really what an interesting thing, I was interviewed by a person writing a book about weight loss programs, and they wanted my opinion about this. And I said, you know what? People get put on phentermine for one reason. And it's not because it works so well. It's because most people have a fear of being hungry. It's not actually being hungry. It's the fear of being hungry. I'm going to be hungry. Okay.
Yeah.
Not like you're losing an arm. It's like, well, what am I going to do if I'm hungry? That's the main thing they say. What am I doing? What am I going to do?
Yes.
And that's what people are afraid of. I'm going to be hungry. Okay. Guess what? The world's not going to stop. You'll be fine. Half the world is starving all the time, and they make it. So it's something that people have to get used to, and that's really kind of what the phentermine is used for. And those people who can't get their head around the fact that they need to be hungry, they need to let their body readjust, not to being bloated and full all the time, to really having smaller portion size, and realizing that it's okay to have a little hunger in there, that you actually want some food and you're ready to eat, not just being from stuffed to less stuffed to more stuffed. And that's really what people do. And so most people don't really even know what hunger is, so they just, I think I'm hungry because it's 5 o'clock.
Yeah.
And that's really what it is. So that's really been my experience with the phentermine. Yes, does it help some people in the beginning? But many people, once they're used to it, they don't need it. There's so many studies, and even in our patient mix of people who, for whatever reason, can't take it, they lose just as much weight taking phentermine or taking phentermine.
People don't lose more weight. We could put them on the same diet. They're not going to lose more weight because they took phentermine. That doesn't happen, and that's what we tell people. But listen, you can do this without phentermine. You can. The phentermine just makes it a little easier if we're restricting your calories and you're hungry and you have a hard time not eating. Then this will help that. But you can do this without phentermine. A lot of our patients do this without phentermine and they lose weight. So it's not something that you absolutely need. Yes, we we can write it, but we're not. One thing about our weight loss program that some people don't, and that's okay, they don't have to like it, is he won't write phentermine for anyone who is not doing our weight loss program. If you're not actually going to diet, then you're not getting the phentermine. And we just make that rule, and there's a lot of doctors that you can go to that will just like write it out like no big deal, but we don't want to do that. We just, hey, you know what? You're going to diet, you're going to work out, you're going to do things the right way, and then that's your treat. If he decides to prescribe it to you, then he can.
Well, because, it may be tough love kind of a thing, but the reality is we want you to succeed. And really, that's really the main goal, is your success and you doing better and learning from the whole process.
Yeah.
The other process that make diets and weight loss programs different is accountability. And that's something that just eating a bar, drinking a shake, or doing any of these kinds of things, they don't provide. You don't have accountability. And there's been numerous studies that that show that people who have accountability for lots of things, but mostly weight loss programs, do way better. And so what happens is they go in, they get additional coaching, they have questions, as opposed to just, I'm gonna try and wing it on my own. You make a lot of allowances on your own. You can rationalize anything when you are hungry. And you'll say, hey, this one is fine, I'll only have one.
True.
And you can hear the people when they tell you, when you talk to them next week, the ones who have not done well, and you say, well, I ate this or ate that, and I didn't really do much. When you really specifically ask them, it's always way more than what they said. And so that's part of the thing. Recording what you eat, that's another valuable thing. If you keep really accurate records and are honest, being honest, you can lie and just write nothing down and you look like you're a superstar. But if you're honest, that's the only way you're going to really do it properly. You will see that all of these little indiscretions, all of these little snacks have added up, and they are contributing, and they are your downfall. And so those are the things that are important, and that's stuff that a program adds more than just a supplement or pill or shot. You can't get any just one by themselves. You can't just come here and get a shot and say, I'm going to lose all the weight.
Shots. So for people who don't know what our shots are, or our super fat burner shot, what is that, and why does that help people lose weight?
Well, there are a lot of people that don't know much about it, and frequently many of them comment about it and talk about it. So that's a frustrating thing. But well, there are a lot of people that are quick to judge and say, oh, yeah, stupid shots, that's going to make you lose weight. But hold on a minute. This is actually real, and they really do help. Yeah.
And it's
there are a lot of mixtures of vitamins that do actually help with weight loss and fat, and what's called lipolysis, which is the breakdown of fat. They help with energy and stuff like that. And so they have been used over and over again. Things like methionine, inositol, choline, all of these things have been used in many, many weight loss settings and have gotten good results. And then when they show people who have taken these things over, not taking them, they've always improved. So in addition to a weight loss program with exercise, they have added benefit. To say, I'm going to take a shot and I'm going to go to McDonald's, they're neutralizing, well, that's just silly. And so that's not going to work. But if you're saying, listen, I want to take everything that can optimize it and help me improve it, that's where they come into play. And they do help and they do work. No doubt. Over and over again, we see that.
Oh, yeah. And then, like he said, there are a lot, there's vitamins in these. And most people are deficient in these vitamins. So just taking them really, really helps with energy and just well-being, overall well-being. And even people who aren't trying to lose weight will get these shots because, like you said, with diet and exercise, they're going to help you lose weight. But if you're not trying to lose weight and you continue eating the same amount of calories, you may not lose weight, but you may feel better from them because these are vitamins that are really great for overall wellness. We're going to go to a break, and then we will be back in about 2 minutes. Do you remember my dad? So, we are on our radio show break, and during our Facebook show for a little treat for our Facebook listeners. We're gonna bring in a guest that's right in the next room, and he doesn't know he's coming in here. Are you gonna get him, Shannon?
I am.
He's lost over 100 pounds.
Mm-hmm.
He's been on our Facebook page, pictures, just pulling that with chair. You can let him sit on the end. Wait, we're on live. Where's Papa? Yeah, he's coming. He's coming. Bring him in here. Oh, he's in. Okay.
He's like,
We're on live.
he's like, not
He's not gonna.
All
Well,
right.
then you're coming in.
gonna. I just told him to do shit.
Come here. No,
All right.
we're about to go back on. This is not our guest that we tried to pull in here on our show. You come in here. Come here. Come here. How much weight have you lost? This is
Yes.
Sophia.
Yeah.
She just loves being on here. We didn't have to force her. But how much weight have you lost? 40 pounds. And this is actually my mother. Yes. Say hi, wave, smile at us. Well. And so you lost 40 pounds, and how'd you lose it?
Died a year. Good. Super fat burner shots every week. Weighed in.
Hormone optimization, thyroid
Definitely,
optimization,
that's-
all of that kind of
The
stuff.
hormone really made me feel great. I wasn't feeling good for many years, and just getting a hormone replacement made me feel me again.
How did it affect your energy level and stuff?
Awesome.
Yeah.
I mean, I just wanted to just do nothing all the time, and now, yeah, it definitely gave everything up.
Good. Okay.
Even though you snatched me out of the hallway, sneaking in.
If you don't know my mom, my mother does not want to be on film, so thanks for coming. And she just was easier to force in here than Papa.
Yes.
But next time, my dad, we're getting him on the show. He's lost over 100 pounds, and I put his pictures on, and people literally have accused me of lying and saying it's a different
Photoshopping him.
person.
Yeah.
But
Yeah.
it is the same person. He's lost a lot of weight. They lost a lot of weight together. So, all right, thanks for coming on. We'll go back to the radio now.
Bye, fans.
Oh, and then Sophia. And we're back, Dr. Tieche and Cynthia from Recharge Clinic in Ocala, Florida. During our little commercial break on the radio, our Facebook watchers got a little treat. So if you are listening to this on the radio, then you need to go to our Facebook page and watch the show to see some people that we introduced. It was kind of entertaining, actually. So I had some more questions about some of the diet things that we were talking about, unless you had something else that you want to talk about instead.
Go ahead.
Go ahead. Okay. So we talked about phentermine, which is some controlled substance, and it helps with appetite. And it's an amphetamine.
Yes.
So then there's phendimetrazine.
Correct.
So what are the differences between those?
So phendimetrazine is in the same class of drugs as phentermine, but it is much milder, and it's an appetite suppressant as well. And so it has been around for a long time. Both of them have been around for a long time. One of the advantages of phendimetrazine is that it's a multiple time a day medication. Phentermine typically is just a once a day pill. Phendimetrazine is usually 2 to 3 times a day. So for people who feel like hungry more in the evening or that, they can kind of tailor their dosing a little bit better with that. The other thing is sometimes people just don't respond to phentermine, or it might be too strong for them. So
When you say too strong, what are you talking about?
some people get a lot of energy from phentermine, and they are uncomfortable with that.
Okay.
And so it rarely makes people jittery, but typically they can get a lot of energy. And so it's almost like an energy drink for some people. Some people enjoy that feeling. It's usually very short-lived, and honestly, it only may last for a couple of days, and then your energy level goes back down. But some people don't like that at all. They don't like coffee or any of things like that, or any of that stimulant. So phenylmetrazine is much milder. It's much more of a selective appetite suppressant. So people tolerate it a little bit better, and so there's that. I mean, as far as other things that people are doing for weight loss, there's HCG.
But wait, hold on.
Okay.
Simmer down a little bit. Okay. Adipex. Is Adipex and phenylmetrazine the same thing?
Yes, it's just
Okay.
a brand name of it.
But then there was another name too. Is there another one?
There's a brand name for it.
Okay. All right. And so now you go on.
Now I can go?
HCG. Now you may go.
Let me speak. So HCG,
But people think HCG is an antidepressant, right? Is it?
No.
Okay.
not at all. So, HCG is a pregnancy hormone, human chorionic gonadotropin, and it's been harvested and used for lots of different things in medical circles. But one of the things that came out was a HCG diet. That came out many years ago, and it was all the rage because people on the HCG diet lost tons of weight. And when you study the HCG diet, put people on it, so HCG actually itself, you have to take it by shots. You can take it by drops orally, but most of the time people take it by shots. And it does actually help with fat burning and losing weight, not a tremendous amount. The premise of the HCG diet was basically a 500 calorie a day diet, which is extremely, extremely low, if people know. That's considered what's called a very low calorie diet, which is really only meant for a very short period of time using. And those are considered dangerous. So people cannot go on those diets for long periods of time. But that was the premise of the HCG diet. And so that's why people had dramatic weight loss, because they were
Well, you're
basically,
eating 500 calories a day.
starved. They were starved. And so you will drop the weight. The problem with when you really take in that few of calories is you're probably not getting enough protein, and that's the main problem. So what's happening is your weight loss is not all fat. In fact, it's minimally fat, and basically what you're mostly losing is muscle mass. And that muscle comes from everywhere. It comes from your intestines, it comes from your abdominal wall, it comes from your arms, your legs, it comes from your heart tissue. And what happens is because basically your body is just auto-digesting itself for lack of calories. Now, so what happens is that's long-term, that's really bad. And that's, that's not a good way to go. So really, there's some modification of that diet. So HCG, there are some people who like to take HCG, they have taken it and it has helped, but really we only recommend it in conjunction with a normal, calorie restricted diet that's going to be in the safe range with adequate amount of protein and things like that, where people are not going to have that type of a problem.
I had someone ask, and will HCG help suppress your appetite at all?
I don't believe it does, and I've not really had anyone say that it has.
I know that is what a lot of people say,
They do.
but I've done a lot of research on HCG myself, and there's nothing proven.
No, and I can say personally, so men take HCG for a different reason. They can take it for weight loss, but men also take it for if they're on hormone replacement for a variety of things. And I've taken it myself. I never noticed one bit of appetite suppression at all, and nor did I notice anything. So we
it's
have
not
HCG
cheap.
here. It's not cheap.
And I feel like a lot of places are pushing it because there's an HCG diet and people will spend any amount of money to lose weight, and it's expensive. So sure, you can make a lot of money selling it, but will it help with diet?
I think one of the
Diet,
things that
not
people
really.
do when they, one of the things that is common is you give patients chores to do that they probably can't do. And so if they don't succeed in the diet, then you can throw it back on them and say, see, you didn't do this. So with the HCG diet, you have to give yourself shots pretty much every day. So that doesn't sound very intriguing for most people to give themselves a shot every day. So, that sounds gung-ho for, a couple of days, then you forget, then all of a sudden 3 days have gone by, and then, you're not losing the weight, you go back and you say, oh, this diet didn't work, and then the provider says, well, were you giving yourself the shots every day? And they're like, no, and they're like, aha, see, if you'd done the shots, you would have lost the weight. Anyway, that's a thing that people are doing. I think that there are many people that have success with HCG diets, but I think if you do it just really less, sometimes less is more, simple is better, and you don't need to put all these chemicals in your body if you don't need them.
And
I don't think they're going to help.
And make sure you're not confusing HCG for HGH, two completely different things.
Correct.
Completely different things. And we prescribe both of them in this office, but again, they're two completely different things. And go ahead briefly just explain what HGH is since I mentioned it.
So HGH is human growth hormone, and so that is used in men and women as they get older, because our growth hormone levels go down, just like other hormone levels go down. And it is used kind of as an anti-aging medication, really. And basically it helps with wrinkles, it helps with skin improvement, skin texture, it helps with muscle mass, bone density, it does help with mental clarity, it helps actually elevate testosterone and stuff. But it is mostly used in low doses for anti-aging. That's really the main indication for it. There's other indications that people use it for, actually growth hormone deficiency in people who are of short stature. There are some people who use it in excess. That's not what we condone or promote. You know, you see some very large bodybuilders, some very large wrestlers. They are taking growth hormone in excess. They become very large. But that's not what we are supporting here. Just like, we support testosterone in physiologic and above, slightly above ranges, not in these crazy ranges as well. So there's a big difference, and you have to do everything in moderation and understand, that not just because a person prescribes one thing that they're automatically condoning the other. They are not the same.
Yeah.
And so they're not, you can go to a bar and have a beer, doesn't mean they're condoning people to become alcoholics. They want you to drink in moderation. And so it's really the same analogy with all of these things. So, it's not, a little is good, a lot is better. That's the American way, but in this case, it's not. A little is a good, and that's enough.
So I have a couple questions on HCG and HGH that people have asked. What are the side effects of HCG?
Some people experience some flushing with it, and actually like a little nauseous feeling sometimes after they get it. That's really the most common side effect. It's actually pretty safe. One of the big things that people have to worry about, particularly females if they're taking HCG, and they were to do a pregnancy test, their pregnancy test would test positive because HCG is pregnancy hormone. So if you happen to be taking HCG and thought that you may have missed your period and then you take it, it's going to be positive. So that's one thing. Now,
And
if you've done sequential HCGs, which like when people are going to go and get them, basically they actually measure the numbers, and the numbers then do not continue to go up. So they would know you're not pregnant, or you would just stop it and it would become regular.
It doesn't make your periods irregular or breast tenderness or anything like that?
It can, there is some suggestion that, you should start the HCG after you've completed your period and start it. There's lots of mention of that. I have not seen that. I've not had that feedback from the patients that we prescribed it to, the breast tenderness nor the irregular periods.
We've got about 2 more minutes. So I'm gonna ask you another question, but I wanted to mention some specials, so make it quick. How is HGH taken?
So HGH, the true form of HGH is taken by injection, and that's how it has to be. There are things that are precursors, which are called secretagogues, which stimulate the natural release of HGH in your body. Those things can be taken orally or by injection as well. But typically, HGH is by injection only.
Okay. So before we finish up today, check out our website if you have not, rechargeocalaclinic.com. We do have some October specials. I will be posting them on Facebook probably in the next day or two. If you're on our email list, you probably got an email today. One of the specials is PRP facials. If you get them this month, you get a free area of disc work, which go really, really great together to give that refreshing glow, the youthful glow, and then also getting rid of some of those wrinkles on the forehead. We also have the special of 2 syringes of filler. If you purchase 2 syringes of filler this month, you get a free chemical peel. I called it the zombie peel. Just trying to keep it fun. Buy 4 super fat burner shots, get 1 free. And hold on, what's my other one? What was my other one? Do you remember? I had 1 more. I'll tell you. I had another special. I don't remember what it was. Anyway, check out our Facebook page if you wanna know the fourth special, cause I don't remember.
It's a mystery.
But you will know, it's a mystery special. Check out our page, rechargeocaliclinic.com, and we will see you next week.